Plastic Surgery in beautiful Marina del Rey in Southern California. They treat every part of your body from head to toe, often with little or no downtime. Dr. Grant Stevens is one of the country's leading plastic surgeons and has perfected his world-class techniques for men and women all around the globe. He works with Dr. Michelle Spring, who shares his passion for the finest procedures in personal care, and the results? Gorgeous. Dr. Grant Stevens is the go-to doctor for the press. He's been on ET Online, Nightline, Good Morning America, The Today Show, The Doctors, and many more. I am so excited to be here. Can you tell us what separates Marina Plastic Surgery from the rest?
Well, we've been here for 25 years in Marina del Rey, and we are a big family. We've taken care of patients for that entire 25 years, and we have patients for life here.
Hi, Dr. Spring.
Hi.
I am so interested in this Cellulase. What is it?
Cellulase is a new FDA-approved minimally invasive procedure used to treat cellulite. And we're really excited about it because up until now there's not been any therapy externally that provides long-lasting results for cellulite treatment. So with this technology, we're actually using a side-firing laser to treat cellulite at the anatomic base. So we're changing the structure of the skin and the fat.
So when you say anatomic based, does that mean that you're actually cutting through tendons?
We make very small incisions and numb up the areas to be treated, and then we use the laser to cut just underneath the skin to cut through the small fibers that are tethering the skin down, making those dimples. And then also we treat the fat that's bulging up around the dimple and then heat the skin up to provide some skin thickening and tightening.
Right, and I've heard that as time goes on, this continues to improve.
It does. What we're finding that patients are very happy right after surgery, even in their first and second post-op visit, but it does tend to improve every month after that as the collagen remodels and everything heals.
Tell us about the gummy bear implant. I think you coined that term.
Yes, I did. The gummy bear breast implants are breast implants which are more cohesive. We call them form stable. It's the next generation. It's the 5th generation in breast implants. Right now, the Sientra breast implants are available to American women. I did a study starting in 2003, and I've done just under 1,000 gummy bear breast implants. And in that study, I found that the gummy bears had the lowest complication rate. They have very few capsular contractures. We didn't see any ripples or any ruptures, and the patients were the happiest we've ever seen. In fact, over that 8-year period, we've not done any removals, any revisions. The patients have been extremely happy.
I love the Vectra 3D room. This looks so technologically advanced. What is this?
It's a really fascinating new system where we take multiple photographs of a patient and it loads into a system that does 3D imaging, and we use it a lot for breast augmentation patients and also for rhinoplasties and chin augmentation patients. We're able to sit with the patient one-on-one and really see how their body would look after surgery by morphing it, and we can even try on different size implants and show what the different sizes would be. So it's really exciting. Patients love being able to see themselves on the screen.
What are the mommy makeovers?
Mommy makeovers, another favorite procedure. We coined that term about 10 years ago to describe breast surgery and abdominal surgery that's done at the same time. So we do a tummy tuck to take care of that extra skin and extra fat that mommies have after their babies. And we do breast surgery, which can be a lift, or a lift and a reduction, or a lift and an augmentation. So whatever breast surgery they choose, along with a tummy tuck and sometimes a little liposuction, constitutes a mommy makeover. You know, mommy makeover patients are some of the happiest patients in our practice.
A lot of people think that plastic surgery and skincare is just for women, but that's not so.
No, absolutely not. In the last few years, we've seen a huge uprise in the number of men who have cosmetic surgery and also who are interested in things like laser hair removal, skin care. It's a huge increasing patient population for us, and we do treat a lot of men here.
Right, facelifts,
Facelift, body
liposuction.
contouring. Yep, and in addition, we see a lot of patients who have had lots of weight loss, either from weight loss surgery or on their own, and so we do a lot of surgeries for massive weight loss patients who have extra skin, and a lot of them are men.
Thank you.
Thank you.
Fire and ice room.
Right.
What is that?
The fire and ice room. That's our non-surgical body sculpting room. The fire, if you will, would be the various lasers that we have there and the various energy sources to tighten the skin and reduce fat. And the ice is the cool sculpting. So in the fire and ice room, we have the cool sculpting for fat reduction. We have liposonics for fat reduction on larger patients. We have the Zerona non-surgical fat reduction. We have the Cellulase body tightening, which is radio frequency, and it also not only tightens the skin, but it reduces the fat. And we also have the thermage, which is also a form of radio frequency, and the body by thermage is used to tighten that crepey skin after the baby, if you're not a candidate for a mommy makeover.
That's excellent.
Yeah.
And then you also have the laser rooms.
Right.
And what is the difference between your fire and ice and the laser room?
Well, the fire and ice room is dedicated to non-surgical body sculpting. So it's fat reduction and skin tightening of the body.
Got it.
The laser rooms are for primarily the face. It can be for the legs too, but primarily it's things like hair removal, spot removal, wrinkle remover. We have 27 lasers, and we have lasers for every color spot you can think of: brown spots, red spots, white spots, spider veins, varicose veins, little broken capillaries, just about everything you can think of. We've got so many lasers there, and even lasers for 20 and 30-year-old people. We have very light lasers. One's called Clear and Brilliant. That's wonderful for young people.
Is it better to start early, and does that actually prevent more spots down the line?
All studies have shown that the earlier you start removing spots and minimizing wrinkles, the better you do. We even have people having injections of various things like Botox, Dysport, and Xeomin to minimize wrinkles in their 20s and 30s. We're doing it for migraine headaches and for sweaty palms or sweaty underarms, but we're also doing it for wrinkle removal in the 20s and 30s.
And what are the boomer facelifts?
Boomer facelifts. You know, we're seeing more and more consultations for facelifts from that 50 to 65-year-old range. Today I saw 4, as a matter of fact, after doing surgery. It's very common that people of my age are coming in and having facelifts. They all want a natural looking facelift. They don't want to be pulled. They don't want to be stretched. So a boomer facelift is a natural looking facelift. It takes 10 or 15 years off of our face and makes us look the way we feel, you know?
I have learned so much about Marina plastic surgery. I just love it here. Thank you so much.
Well, thank you for coming. We appreciate it.
We look forward to sharing more information for a more gorgeous and confident you.